Section 2, Factors Affecting Addictive Behavior. Risk factors in the development of addiction. Stressful life experiences, for example, sexual abuse, combat stress, marriage dissatisfaction, and physical illness, can make an individual more vulnerable to developing an addiction or more likely to relapse into addictive behavior. The self-medication model suggests that addictive habits may develop as a self-medicating treatment for stress, for example, alcohol, or as a perceived stress relief, for example, nicotine. Recent research has investigated the link between stress and addiction. Addiction is associated with raised levels of dopamine, and researchers have found that high levels of stress also increased the reactivity of dopamine receptors in the VTA, the ventral tegmental area of the brain, showing that stress and addiction may be linked through the dopamine system. AO2. Turner et al. 2002 found that many problem gamblers had endured unpleasant life experiences the year before their addiction started. Wills et al. 2002 surveyed 1,364 teenagers and found a significant correlation between high life stress and addictive smoking. However, individual differences. Stress may create vulnerability in some people but not in others. Cloninger 1987 suggests there may be two types of alcoholic. Type 1 drinks to reduce tension, anxiety, and depression, and Type 2 drinks to reduce boredom. Stress may explain vulnerability for the Type 1s, but not for all people. Peers. Peer influences have been found to be one of the strongest predictors of drug use during adolescence, providing drugs, modeling drug-using behaviors, and shaping attitudes about drugs. Two theories are relevant for the development of addictive behavior. Social learning theory, by Bandura, 1977. Addictive behavior is learnt through observation of valued role models being rewarded for their smoking, vicarious reinforcement, and subsequent modelling of the behavior. Young people are most likely to imitate the behavior of those they have most contact with, their peers. Social identity theory, Abrams and Hogg, 1990. Assumes that people identify themselves as members of particular groups, for example smokers, and increase their self-esteem by adopting the norms and behaviours of the group to which they belong. In peer groups, where status as smoker or non-smoker is central to the social identity of the group, individuals are more likely to be similar to each other in their smoking habits. Bricker et al. 2006 offered support for social learning theory. They studied the influence of peers and parents on teenage smoking on 6,006 participants from the USA in a longitudinal study between 10 and 17 years. They found peer smoking was most influential on first trying smoking. However, the authors also emphasized the importance of family members and their attitudes and behavior. Bauman and Ennett, 2006, suggest that the influence of peers is overemphasized. They found that a young person chooses peers who share the same attitudes towards addictive behaviors rather than being influenced by their peers, providing support for social identity theory. Other evidence has suggested that experimenting alone with cigarettes and drugs is a key factor in the development of addictions. Age. There is a positive correlation between the age at which a person first starts a potentially addictive behavior and the likelihood that they will develop an addiction. Teenagers who start using alcohol, nicotine, or other drugs at an early age have a higher risk of developing an addiction later on. It is not clear whether this is due to genetic factors or whether it is a learned behavior, and further research is attempting to identify the exact mechanism involved. Parents also influence a child's addictive behavior. Parents' drug use has been linked to the age of onset and frequency of alcohol and cannabis use in adolescence. Parents with more permissive attitudes towards drug taking are more likely to have children who start taking drugs at a young age. The same pattern has been found with gambling. AO2. Fiedler et al. 2006 carried out a longitudinal study of 6,000 adolescents. Those who had tried a cigarette by the age of 11 were twice as likely to be regular smokers by the age of 14. They were also more likely to be heavy smokers when older. Swenson et al. 2012 suggests this is a particular problem for young people as their brains are still developing and could be permanently affected by their nicotine addiction. However, most of the research focus has been on young people. Generally, addictions in older people have gone unreported. About 1/3 of alcoholics develop their habit during retirement. The Swiss Health Survey 2007 found 46% of men over 75 drank daily, compared with 6% of 25 to 34-year-olds. Personality. Eysenck, 1997, has suggested that an individual develops an addictive habit because it fulfills a purpose related to the personality type of the individual. 3 major personality dimensions have been related to the development of addiction. Neuroticism. People high in neuroticism tend to experience negative emotions, such as depression and anxiety, and are more likely to develop addictions. Psychoticism. People high in psychoticism tend to be more aggressive and impulsive, react without thinking through the consequences, and are more likely to develop addictions. Extroversion, introversion. Extroverts seek external stimulation to increase their cortical arousal and are more likely to develop addictions. AO2. Gossop and Eysenck, 1980, surveyed over 200 polydrug addicts using the Eysenck Personality Questionnaire. They found a significant association between both neuroticism and psychoticism and addiction. Alcohol, heroin, and nicotine achieved higher than normal scores in neuroticism and psychoticism. Zuckerman, 1983, suggested that people who are highly extrovert sensation seekers have a high susceptibility to boredom and seek out novel experiences. This would predispose them to seeking a high from addiction, but the evidence is not clear-cut. There is some evidence that personality factors cause the addiction. Canals et al. 1997 gave Spanish adolescents aged 10 to 11 the Eysenck Personality Questionnaire and were followed for the next 8 years. When tested at age 18, psychoticism was the best early predictor of dependence on alcohol and nicotine. This supports the idea that personality characteristics predate addiction rather than addiction-altering personality. Representations of addictive behavior. Media portrayals of addictive behavior. These can cause controversy because of claims that they glamorize addictive behavior. Gunasekera et al. 2005 surveyed the top 200 grossing films, showing that portrayals of drug taking in films were overwhelmingly positive and without negative consequences. Social learning theory, specifically learning through observation of valued role models being rewarded for their addictive behavior, would provide an explanation for the influence of the media on addictive behavior. Film and TV representations of addictive behavior are important as they provide enduring stereotypes of addicts for other people and for the addict themselves. AO2. Sargent and Hanwell-Winkle, 2009, found that more adolescents are exposed to movies with smoking, the more likely they are to smoke. 4,384 adolescents aged 11 to 15 years were surveyed twice a year apart. The researchers found that in those individuals who had not smoked when they were first surveyed, exposure to smoking in the movies was a strong and significant predictor of whether they had begun to smoke when surveyed a year later. However, questionnaire study, so social desirability is an issue. Difficult to determine the extent to which they had been exposed to smoking in the movies. Distefan et al. 1999 found that the more likable film actors and actresses who smoke both on and off screen are perceived to be positive correlates with their adolescent fans' decision to smoke. This shows the importance of social learning theory and the imitation of value role models in the initiation of addictive behavior. The role of the media in changing addictive behavior. Television and the internet have been used to help people give up their addictive habits. Television is an ideal medium for getting across messages about the dangers of alcohol, drugs, tobacco, and gambling. Not only does it provide easy access to a large number of people, but it also provides the capability to target campaigns at particular groups of people. The role of educational programs can be linked to the theory of planned behavior, in that they aim to change individual attitudes to the addictive behavior and also change the social norms surrounding the addictive behavior. For example, The Really Useful Guide to Alcohol was a 6-part, 30-minute BBC TV series, 1989, which aims to inform people and encourage them to drink less alcohol. On a larger scale, between 1998 and 2004, the US government invested $1 billion in anti-drug media campaigns aimed at changing individual attitudes and social norms towards drug taking. Bennett et al. 1991 researched the effectiveness of the PSS campaign and concluded that it had increased people's awareness of alcohol-related issues, but had had little or no impact on their behavior or consumption of alcohol. Johnston et al. 2002 suggests that the US campaigns may actually have increased cannabis use. The impression inadvertently a given is that drug use is commonplace and people feel they are missing out by not partaking. Measuring the effectiveness of media campaigns is difficult because other factors are involved that can affect people's decisions to carry out or stop an addictive behaviour. However, most of the evidence about media effects on addictive behaviour is correlational and does not indicate a causal relationship between exposure and addiction.